You will learn about information management,
Amitabh Saxena will be joining us in the next 5 minutes.
and let me give a little bit of introduction about myself, and after that, maybe I will we'll start learning. I'll focus today on data analytics part, but yeah, some of you have requested about learning on lean as well. So I will. Last time, actually, I did cover lean. This program I keep doing often, and today I have got a throat infection. So yeah, a little bit of energy is a little down. So, but I'll try to. I'll try to act as if I'm energetic. Sometimes you have to do that, right? Okay, and as healthcare professionals are expert in doing that. So, welcome to CPHQ introduction training and CHQ certification. So, if you don't want to appear for the CPHQ exam, a lot of people they say that we have learned lots of stuff in healthcare quality, but we don't want to write a CPHQ exam, or maybe we don't want to write it now. Maybe we'll write it later on. Then, if you just attend the full CPHQ preparation course, you get a CHQE certification from Anexas. So that is also something which you can carry with you if you attend our full-fledged course. Okay, so I'll start with what is CPHQ and then what are the benefits and what are the modules. Then we'll jump to the healthcare data analytics. And as I told you, some of you wanted me to cover the lean. So lean also very quickly, I'll cover today lean. Then after that, we'll start learning about lots of tools and techniques related to data analytics. And I'll not cover today too much about patient safety. And we'll try to give some examples, some improvement projects examples from the healthcare if possible. And then we'll have some discussions. Regarding the organizations, we have been doing training programs since 2006 and trained more than 150,000 people, more than 1,500 certified professionals in healthcare quality, CPHQ. So, in fact, we have lost the count. It is much, much more than that. But yeah, last we counted was 1,500. And it's quite a big number. Total certified professionals in whole world, they are around 15,000. And the people who appear for exam, who conduct training from us, who appear for the exam, they're going by our record. Whoever has appeared for the exam, they have always passed. Some people, earlier they have appeared and without our training, maybe they did it, somewhere else. And when they fail, when they attend our trainings, they pass. And a lot of people keep telling us like that. So anyway, we have trained worldwide some photographs to prove that I have conducted training programs worldwide. So if you are joining the CPHQ session, you will be joining my session. So I also conduct Lean Six Sigma, PMP, CPHQ, AI, and data science programs. So that is my forte. And CPHQ I have been conducting for the last, I think now 11 or 12 years. And every year, lots and lots of people, more than 100 people have passed. And we are always happy to tell those numbers. So this is China. So right from China to Saudi Arabia, Australia, to US, we have done training programs. People from US, they attend our training programs online as well. We have won many awards and various forums, Hospital Management Asia for the 10 years continuously. I was a speaker, and three times I was a keynote speaker as well. Then, I've also done a lot of work in healthcare in Lean and Six Sigma implementation. And this is one. Let me show you one video. One of the certified black belt from us, who has completed a project in National Healthcare Service in UK. He's talking about his project. Well, we have Alex with us, and he has done excellent Lean and Six Sigma projects in National Healthcare Service and in hospitals. So, Alex, would you like to tell us something about it?
Hello, I'm Alex Wells, Head of Service Improvements at the Royal Liverpool University Hospital. I've been really fortunate to present today on how us as a trust are using Lean and Six Sigma principles to deliver better care for our patients. I've presented today on a lot of the work that we've done around how we've improved patient outcomes, reducing mortality, improving length of stay, and also talked about how we can actually realise some financial benefits from that. Over the past 2 years, we've been really fortunate that we've done some good work, and it's actually delivered us £2 million worth of quality efficiencies through delivering better patient care.
So being a CPHQ professional is just not, talking about quality or doing an improvement project, but also saving a lot of money. And we have done these Lean Six Sigma projects in various hospitals, and a lot of CPHQ.
Mr. Andrew Robertson with us.
Anyway, we've got a lot
of King Edward VII Hospital in London, and
a lot of videos. But maybe quickly, if I also those who are from Indian subcontinent, they might
I am Shekhar
know
Suman,
about
and I wish to
Steve
congratulate
Business
all the
TV
Six
show.
Sigma certified.
He is a very popular TV show host where I have presented lots of process excellence, 13 episodes of process excellence related topics and programs. Quality American. On 21st of May, I have 30 years of experience, 33 years rather, as well. Maybe I will just lots of in Pakistan as well. We have got lots of projects, lots of work we have done, improvement projects, quality related projects. So we are not only teaching, we are also actually implementing whatever we are preaching. So being a CPHQ is not only just passing an exam. You have to also implement that knowledge. Obviously, in the exam, you will not be tested on implementation part. It means, if you know the implementation part, you can pass the examination. But after you are a CPHQ, it is expected that you bring in some positive change in your institute or your organization or your medical college or hospital or a clinic or a lab. Okay, so it is very prestigious, CPHQ. I'll not talk too much about it because most of you are already aware of it. I'm not, I'll just quickly pass that part, But it will be a good idea. Some of you might be interested in knowing how many chapters are there. So there are 7 lessons. And when you join our training program, you can So you can, you will learn each and every chapter in detail with a lot of examples and practice questions so that you pass the examination. But for the time being, I'll just give you a brief overview, and we'll choose 2 or 3 or 4 very difficult topics from CPHQ and the learning course, and then we will elaborate on that. So first lesson is about the quality, leadership, and integration. It's about creating a strategic planning. As a healthcare quality professional, you should be able to advise the leadership on organizational improvement opportunities. How are the best improvements done? They are done by converting the improvement opportunities into projects. So what you do as a quality professional, you convert the improvement opportunities into project. And what is the definition of a project? The basic definition of a project is that it is a starting point and it is an end point. It doesn't end after some time. So you help the leadership choose multiple projects, assist with the development of action plans, and then assist with the establishing priorities, which project should be done first, which improvements should be done first. That's how you assist them. And then engage the stakeholders, all the employees, all the people, all the managers, anyone. The definition of a stakeholder is that any person who is positively or negatively impacted by your improvement project is a stakeholder. So engage those stakeholders. And that's what this chapter talks about. Then we also, moving on to the second chapter, performance and process improvement. Now here you will learn a lot of tools and techniques like Lean, PDSA, Six Sigma, Fishbone diagram, FMEA, process map. And in fact, Anexas as a company is well known for delivering great quality training programs and statistical tools and techniques. So those who attend our program, they never fail CPHQ. One of the reasons is because around 67% of the questions are related to data analytics and process improvements. And we prepare you so well that these 70% of the marks are not going anywhere. Plus, of course, the other topics like organizational leadership, patient safety, or healthcare population, etc. They are important and they also carry some weightage, but they are not so difficult. So I'm purely talking from exams perspective. And so this was a performance and process improvement. Here you learn how to do the projects, how to conduct the trainings, how to ensure that staff is trained, what is the importance of training, Kirkpatrick model, how do you evaluate the training? How do you evaluate the training? Generally on 4 bases. First is how the people are reacting in the classroom. Then second is, have they learned whatever has been taught to them? You can do this, you can check this by conducting a test or an exam. And after that, you have to watch their behavior. Has the behavior changed? And the fourth and most important thing is, are you getting the desired results? So that's what is about Kirkpatrick model. So train the people, evaluate your training effectiveness, etc. That's what is again covered in or as part of the role of a quality professional. Then also population health and care transitions. It's very important now, given the pandemic. These topics have been included in the quality. And if you are able to reduce the cost of healthcare for the government, because most of the countries, government is mainly responsible for healthcare. And by reducing the burden on the healthcare, you can always reduce the burden, financial burden on the government. So how to do that? And then healthcare data analytics. Here you learn lots of statistics, basic statistics, mean, median, mode, the different structures, supplier, process, output, customer, SIPOC, which we call it as structure, process, outcome, and experience measures. So how to create measures. And we'll also learn how to, not today, because I'm planning to take you through data analytics. We'll see how to, measure everything. And you cannot improve if you cannot measure. So today we'll talk about that. Then we also, briefly we'll touch upon the measurement and analysis part, some analytical tools I'll be discussing. And I'll show you, if time permits, I will show you some projects done in the hospitals. Then the fifth lesson is about patient safety. where around 18 questions are there. And usually no one fails in this section. And quality review and accountability, it is about maintaining the documentation so that you can get if there's a pay for performance announced by the government, then in that case you are able to get all. This is so now. So that was about. So that was about. I'll also pull out my. Yeah, there's a book called SK Solutions book. So we generally follow this book, and we give you enough material. So you don't have to really buy the book. We give you material which has been extracted from this book. It's quite a thick book, studying this, of course, we encourage you to study that book. But if you attend our sessions, it's good enough. It's equivalent to going through the book. So the idea is that we will provide you that, and apart from that, more than important, that explanation and the notes, and also we provide you the videos as well of the important videos, the tools and techniques, everything. So we prepare you for the CPHQ course that. Not only you will pass the examination, but after that you can start guiding others also, like how to pass the examination. Most of our, attendees, they generally refer their friends. So thanks for joining in, and now let me take you through. Now, up to you. Let us make an agenda which works for you. Today, I'll not go into the organizational leadership, etc. Although it's also an interesting topic, but today we have chosen data analytics. But by the way, if you are interested in some of the videos related to leadership, one of the video I'll recommend, which is also there on the YouTube, and I have made, is about 5 levels of leadership. And these are the different 5 levels of leadership by John Maxwell. So John Maxwell's 5 levels of leadership. I will leave it to you to see that video. You can watch that. I'm not going to talk about leadership too much, but let me jump directly into the process improvement part and also the data analytics parts. So the data analytics and process improvement, they go hand in hand. And some of the very, very popular techniques used in healthcare are Lean, Six Sigma, PDSA. Today, I will touch upon a little bit on Lean. I'll touch upon a little bit of Six Sigma, and I'll show you a Six Sigma project also while learning about the data analytics part. In CPHQ, you don't have to really master the whole methodology. You don't have to become a PDSA expert, or don't have to become a Lean expert. You don't have to become a Six Sigma expert. To become a Six Sigma expert, you have to attend our another training, which is Green Belt or Black Belt. And many of the people in your region, they have attended our training programs, and we are quite popular for the Anexas is quite popular, especially our European headquarters. They are very popular in certification business of Lean and Six Sigma, Green Belt, Black Belt, etc. Our Australian, like Anexas Australia, is responsible for the certification in the Australian region. Those who are attended, I don't know. Today is not the time for the Australians, but if you are watching this video, we have a presence in Melbourne also, and we conduct regular training programs of green belt, black belt for hospitals, healthcares, artificial intelligence, and data science for healthcare. Please watch 1 2-hour video. My team will put that link here. Please watch this 2-hour video on artificial intelligence and machine learning introduction for healthcare professionals. I've tried to explain the basic algorithms which are used in AI and ML, and that will give you a little idea of what's going around. Sometimes you might be confused with these jargons of AI, machine learning, deep learning, and random forests and all that stuff. So this will actually give you some good knowledge. Okay, let us jump to the lean part. So a typical hospital environment has got high volume, high variety, high variability, high speed, high stress, high turnover. And excuse me for my throat today. Usually I'm more energetic, but today, due to some, I'm under the weather today. So I need a doctor. By the way, my wife is a doctor, so happens. Sometimes I'm the patient. Okay, so see, typically every hospital, there are service breakdowns, wasteful processes, and medical errors. So in this module, I'm going to talk about wasteful processes, and typically lean is about war on waste, identifying the waste in our systems. Now, this waste is not the one which we throw in the dustbin, but it is the waste which is present in our processes. Now, we are not aware of it. It is wasting our money, it is wasting our time, which is very, very important. And try to develop an eye to identify the waste in your system. How to do that? You can do Gemba. Gemba means go to the field, go to the place of action, and observe what are the types of waste. There are 7 types of waste. Very briefly, I'll just talk about them. Waste of intelligence, waste of rework, defects, errors, waste of waiting, inventory, motion, transportation, overproduction, overprocessing. Now, this is mostly generally when we conduct the introduction to CPHQ, we increase our speed because this is more like giving you an overview. Now, we are not going through the details of any topic. We are giving you the bigger picture of many topics. Of course, we'll be going a little deeper into that data analytics part for some time. And then, of course, we'll try to give you lots of other topics, knowledge of a lot of other topics. So when you are identifying the muda means the waste. Waste. What is waste? What is the definition of waste? Any step for which the customer is not willing to pay for is a waste. So you may think it is required, this particular work, this particular step is required, but in a process map, if you find that the customer is not willing to pay for that step, it is designated as a waste, which is known as a muda in Japanese. To remember those 7 or 8 mudas, you can use ISWIMTOO, I swim to. Or you can also use downtime. There's the same abbreviation is downtime. Or you can rearrange these words into Tim Woods. So, left to you, whatever you choose, you can remember those 8 wastes, because these 8 wastes are very much present in our organization. We are not aware of it. And try to identify them, and you will reap huge benefits. So when you are looking at some of the obvious wastes, which are very much, can be seen by naked eye, or you can realize. So you can always, try to work on them. But a lot of waste is not seen; it is hidden, like overtime, overstaffing, insurance reimbursements, they are all burden on the exchequer, on the government, right? Subsidies. So just to understand what is the basic definition of a waste. So the basic definition of a waste is anything which the customer. So if you were to tell me, if you were to ask me, so what is the definition of a waste? I'll give you the three conditions. If any of these three conditions is not satisfied, then that step, this process step becomes the waste. That activity becomes the waste. So the patient or the government, like basically customer should be willing to pay for it. Should be willing to pay for it, for that step. Yeah. If willing, that means it is value added. It is value added. And if the customer is not willing to pay, then it is non-value added. The second is, it should be done right the first time. Done right first time means if you are doing something again after committing a mistake, that means when you committed the mistake, you wasted time, money, resources of the organization. So it should be done right the first time. This is one of the important criteria of branding any step as a value added. And if it is not done right the first time, if it is done second time, third time, after committing a mistake, anything starting with review, rework is a waste. Because you wasted the time, while you committed the mistake. So do it right the first time. And then also, it should bring to designate a process step as a value added. It should bring the inputs closer to the output. Closer to the output. Or bring it to finish. To the output. So let us take an example. So you can see that walk to the OPD, registration. These are all, see, as a patient, I'm not willing to pay for registration, walking to lab. First, you have to think about what is the value add from customer's perspective. Now, as a patient, let's say I'm the customer. As a patient, I'm interested in knowing my health status. That is the value I'm looking at. I'm not, see, the output that whatever product or the deliverable which we are getting out of my process, we think sometimes that is the value. It is not the value. It is giving you the value. It is providing you the value. So the test itself is not the real value. Actually, the information which I'm getting from the test, that is of value. So to create that value, there are lots of steps I'm doing, like waiting, registration. The registration is not going to tell me about my status. So they are all non-value added activities. Now, some people might object to that. This is to get the testing done, you need to register. Well, that's your process. There are some labs, and there would be labs where you don't have to register. You can just go and get the blood test done and get the results immediately. So we are looking at that, what is value added and what is non-value added. So please remember and think from customer's perspective, not from your perspective. Then the wasteful hospital, example of a hospital where the waste of intelligence is evident. 80% of the nurse calls are housekeeping in nature, means people are unnecessarily wasting the time of the nurses by asking about the works to be done related to housekeeping, like my pillow cover is dirty, my bed sheet is not okay, etc., etc. So this is wastage of time of the nurse. A nurse will forget to give you the medicine if you try to indulge the nurse into some other activities. It is waste of intelligence. Another waste of intelligence is surgeon is waiting for the operation theater to get ready. That is again waste of intelligence. So by using those lean principles, identifying the waste in the system, reducing the waiting time, etc., by redesigning the flow, we were able to double the cardiology lab capacity from 8 to 16. Now the whole case is written here. I'm not going to talk much about it right now. The idea is to give you the bigger picture. So here, reduce. You were able to reduce diagnosis to exam time from 2,000 minutes to 64 minutes. Before, like if I just let me talk about this. So patients earlier had to wait up to 6 days between the cardiologist exam conducted in the doctor's office and the treadmill exam conducted in the diagnostics lab. So it was a waiting period of 6 days. Typically, the whole process would take 6 days. So now, after observing the flow of the patients from the cardiologist's office to the diagnostic lab, 2 physicians decided to see the patients in the diagnostic lab. Now, patients make appointment to see the cardiologist there. And the daily schedule for the diagnostic exams was changed, so patients could get both exams done on the same day. So drastically, you could reduce the time. So lots of examples are there, but just identifying the waste in the system and creating and focusing on value only, you can achieve great results. So typical patient flow looks like this, and we identify which is value added, which is non-value added. So value added, non-value added. So this step is value added, okay, value added. This step is non-value added, that is waiting. This step is value added, okay. This step is okay, this is also value added. This is non-value added, any delay. So non-value added. So you try to classify all the steps into value added and non-value added and try to reduce the non-value added activities as much as possible. Today, as I promised, that I'll be focusing more on data. So let me quickly rush through some of the examples of waste. So unnecessary process, motion, unnecessary waiting, unnecessary transportation, errors. They are all examples of waste. A person who's underutilized is a waste. An equipment which is underutilized is a waste. Even overutilized is also waste. Cost of 5 minute MD walk is costs money. And similarly, if you look at this, you can say that the nurse cost per hour, if it's $50 per hour, the cost of one trip is $5, and it really costs even a single nurse to move around. And just think of a hospital which has got 200 nurses multiplied by 365 days. You can imagine the kind of wastage we are talking about. Okay, so try to locate or co-locate the equipment which are often used. So rather than going from ground floor to second floor every time, bring them down to same floor after observing a spaghetti diagram. Spaghetti diagram is a visual map of how the people are moving in our, let's say, I make it on the ground floor near the reception area. And I have got reception here and some, let's say, some clinics here, OPD. Yeah. So if I observe and I find that most of the people, they are coming here, then they are coming here. So you will get a spaghetti diagram. Spaghetti diagram is, it's like a movement of the people. So you can see that maximum traffic is coming from here to here. So why not I make a reception somewhere here, and this particular booth I can, or table or the station or the clinic, whatever it is, I can be shifting to near the reception. So that I will reduce a lot of waste of motion in the organization. Similarly, you can use visual controls to reduce the errors and mistakes by using certain visual controls. And similarly, using visual controls, we can improve our efficiency as well. Hospital should be a visual hospital. People should not waste time and money. Time is money, right? So they should not waste their time by asking or seeking directions. So I try to have a visual hospital. There's a concept called mistake proofing, also known as pokayoke. Pokayoke in Japanese means mistake proofing, or it also means a fool proofing. Even a foolish person cannot commit a mistake. Like a person, a foolish person like me who tries to cook the rice, he will always forget. So the rice cooker automatically gets switched off. Even a foolish person like me cannot, burn the rice. So similarly, develop a system so that you are not allowed to commit a mistake. So some of the examples, some of the machines can't be operated beyond the safe, normal, safe or maximum levels, or and some of the medicines cannot be entered beyond the in the abnormal values range. Like, so normal range is this, so this something like this will be rejected. Similarly, oxygen cannot be connected to nitrogen cylinders because of the connectors. The shape of the connectors is totally different. Other examples of pokayoke could be fixed number of packages during the surgery, complete catheter kits for insertion, etc. So these are all examples of pokayoke. So I briefly covered about lean, what is lean, or and let me now jump to the data parts. So there will be quite a good number of questions, 40 to 50 questions on data analytics. Sometimes it's a mix of data analytics and process improvement. So altogether, they comprise around 70 questions. So very, very important to learn those chapters. Now, do you agree that some data can be measured and some cannot be measured? So, Aldicine is asking after the CPHQ course how to take the exam. So once you join our CPHQ course, I will guide you fully how to take the examination. You can appear for the examination sitting at home as well. Okay, so do you agree that some of the data can be measured? Something can be measured, something cannot be measured. Some of you are telling yes, some of you are telling no. Okay, so let me tell you, you cannot improve if you cannot measure. And the second part is you can measure everything. Yeah. Now, how to measure everything? Let me tell you. So there are two types of data. What are the two types of data? Continuous data and attributed data. Continuous data is something which can be represented on a number line. It can be represented, it can take decimal places, it can take, it always has a unit, something like this, procurement time, waiting time of patient. It could have 16.2 minutes waiting time for the patient. Similarly, you have got height, weight, blood pressure. All these are examples of continuous data. Then you have got attribute data. Attribute data is something. So one of you telling you're planning to join CPHQ. Very good. Welcome. Okay, great. And when you join my session, my speed is very low, and generally, we usually explain everything with a lot of examples. Right now, it's like a little fast-paced explanation of lots of tools in a short time. So have you, Leila, have you attended our training session before? So have you attended our training? So some of you are asking questions. Yeah. So those who have attended our sessions, you can just connect with us and you can just join us. I think there's almost, depends on when did you do it, but you can join it. Just connect with one of our persons and you should be able to get it. and May is telling first time. So first time you'll have to register. Yeah. So once you register with with us, you can attend the session multiple times. After 2 years or so. I'm not foreseeing that you'll be attending after 2 years. You can, of course. Sometimes people say, "Well, I did not appear for the exam this year, but I finally got an opportunity to appear for the exam after 2 years." Most welcome. You can again revise. Again, you can join our session for revision. No problems. Okay, so now answer your. Just can you please? By the way, I'm just telling, speaking to Laila here, because you have attended our sessions before 15th 2023. So there have been some changes. They're not major changes. They're like, say, 10-20% of the things. See, 10 to 20% will be there. The changes will be not more. Basically, the idea is that the changes won't be affecting. Like if you have attended our training session before, then in that case, I think somehow my video has stopped. Can you please allow me to share the video? My team. Yes. Yeah. Thank you. Yeah. So as I was telling that if you have attended our training program before CPHQ, much before, don't have to worry too much. You can have, there is hardly 10 or 20% changes. So you can again attend our session. Once you are our alumni, you can attend our session any number of times. That's the whole idea. Okay. So now let us see how to, what is continuous data and attribute data. Let's look at that. Let's look at what is continuous data and what is attribute data. Now, if I just go to my, okay, let me ask you a question. See, let me also understand. Let me try to understand whether, you have understood this continuous data or attribute data or not. So there are two types of data, as I told you, data types. Data types, two types. Continuous and attribute. So continuous data, one example is waiting time, right? Waiting time. And when you are plotting any continuous data, waiting time, when you're plotting waiting time, let's say 30 minutes is the waiting time. Okay. The data will look something like this. One patient waited for 35 minutes, another patient waited for 32 minutes, another patient waited for 25 minutes, 26 minutes, 32 minutes, and so on and so forth. Yeah. So average is 30 minutes. And it will also have a standard deviation. So this is I'm talking about in case, just in case. You have got the data, which is continuous. Now, what is standard deviation? I will not be telling in detail right now, but if you are interested, and I'm sure you are interested, just watch this video. This video is around 10 minutes to 12 minutes, but it derives the formula of standard deviation. So you will learn about standard deviation really thoroughly well. Now, I'm not going to spend too much time in standard deviation explanation because that is really not required as a CPHQ. But you should know there exists a standard deviation. They will not ask you to calculate standard deviation, but they will ask you what is the use of standard deviation. And that is what you should be knowing. So you have got standard deviation as 5 minutes. Well, you can always draw a histogram when you are dealing with continuous data. So typically, the waiting time will look something like this. Most of the patients are waiting for 30 minutes. Some people are waiting for 35 minutes. Some people 40 minutes. Some people up to 45 minutes. Almost never they go above 40 minutes, 45 minutes. And similarly, some people up to 25 and 20 and up to 15. Almost never they go below 15. Almost never they go above 45 minutes. This is known as something called as normal distribution. Normal distribution. Why it is known as normal distribution? Because it is normal to operate, normal to obtain a normal distribution. Okay. Mr. Carl Friedrich Gauss, he found this theorem called Gaussian theorem. He said that almost all the activities which are repetitive in nature, they follow normal distribution. Okay. So that's what is normal distribution. Now the continuous data will follow normal distribution. Now let us hold for some time here and let's look at the attribute data. Attribute data is something which generally we feel cannot measure. Something we feel we cannot measure. Like for example, can you tell me something which you cannot measure? Okay. So Sheena is yes, asking some question. Okay, I think my team is taking care of you. And you have got okay. Yes. Janet told that, earlier, Janet and Sophia said that, you agreed with me that, if something cannot be measured. Yeah. So can you tell me something which cannot be measured? Yeah, Mohammed, Sobi already told that all the data can be measured. I think you have attended my session before. Okay. 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 So can you tell me anything which we cannot measure? The thing is, let me create a measure. So in a way, many of you are right that there are certain things which cannot be measured easily. What you mean is that no, you cannot measure things, some things very easily. And in a way, you are right, like patient satisfaction. Okay, Sheena is telling patient satisfaction. Now, certain things, eye color. Sophia is taking eye color. Okay, so patient satisfaction. Okay, and eye color. So the best way to measure any attribute data, see, create a category. Create categories in that attribute. Like, for example, patient satisfaction, a simple category I can create is satisfied, dissatisfied. This is very simple. I can even create highly satisfied, satisfied, neutral, dissatisfied, and highly dissatisfied. I can create 5 also, but I'm right now creating only, just to keep the thing simple, satisfied and dissatisfied. Excuse me for as I told you, now I just had a cup of coffee, so I'm little energy has come back to me. And also actually, my handwriting is otherwise good, but yeah, today anyway. Yeah, so Nahid is telling he's not able to hear my voice. I think I'm pretty clear. Maybe just switch off and switch on, log out and log in. That sometimes works. So check the audio device. I think audio is fine. That's what I feel. Yeah. So satisfied, dissatisfied are the 2 categories I will create, and I will count. How many satisfied patients, how many dissatisfied patients. So in a way, let's say I surveyed 100 patients and 60 are satisfied and 40 are dissatisfied. Then how will I measure patient satisfaction? I will create categories and count and proportion. So when we deal with attribute data, yeah, we measure in terms of proportion. We measure in terms of Proportion. Okay. And we can also measure in terms of percentage. People are habitual in measuring the percentage. See, these all things are coming under CPHQ, your proportion, percentage, average, standard deviation. What happens is typically people are aware of average, standard deviation, proportion, percentage, but they don't know when to use the percentage and when to use the standard deviation. So that's the real thing. That's the real thing. And that's what we're trying to drive home the point. So percentage wise, you have 60% here and 40% here. And here I have got total 100%. So proportion is nothing but out of one portion. If you imagine a circle and it is 1, what is the portion out of 1? That is proportion. So 0.6 is satisfied patient and 0.4 is dissatisfied patient. And in percentage, the circle, imagine it to be 100, then it will be 60 and it will be 40. And then there is the ratio also. An attribute, you can have a ratio. Ratio will be 60 divided by 40. The two categories, 60 is to 40 or 60 divided by 40. So I can make 3:2 or 3:2. This will be the ratio. Satisfied to dissatisfied patients. Ratio, proportion, percentage, they are all coming under the attribute data. I hope you got the points. Now, it's very important to understand what is continuous data and what is attribute data. By the way, I have, by the way, risk management is also there in our CPHQ a little bit. So in order to, take care of the risks of maybe there's a problem in internet connection from my side or something, we have created excellent videos which we give it to you. When you join our sessions, we give it to you. So apart from of course, the recorded sessions, all the recorded sessions are given to you. Plus some very professionally done videos are also given to you. Say, for example, if in this video, I'm explaining Lean and Six Sigma, I'm explaining the types of data. So let me, let me show you that. The same thing I'm explaining, and just to give you a glimpse that, There are two types of data, continuous data and attribute data. Continuous data can be represented on a number line. It can have a decimal place. It can also have a unit. Say, for example, age, height. Age is 52.5 years. That's my age. Well, that video was recorded 2.5 years ago. So my age is now almost nearing 55 for your information. Height, maybe 180.1 centimeters. Cycle time of a process, 3.5 hours. Or procurement time in an organization, 120.3 days. These are all continuous data because they all have a possibility of a decimal, means they can be expressed in decimal points, and also they all have a unit. Now let us talk about attribute data. Attribute data can be expressed in categories, and categories can be counted. Say, for example, if you want to measure happiness, so easiest way to measure any attribute data is to create a category, and if possible, you can create a binary category. A presence or absence of that attribute can be one of the simplest categories. So if I take the example of happiness, two categories I can create: happy, unhappy. So if I want to increase the happiness in the employees in the organization, then I can always count how many employees are happy. Let's say 60 employees are happy and 40 employees are unhappy. I can express this as proportion. That means proportion of happy employees in my organization is 0.6 and proportion of unhappy employees is 0.4. And it can also be expressed as percentage. Now, this proportion or percentage, they don't have a unit. And a count, like 60 employees, I can't have 60.1 employees who are happy. So the count will not have any decimal point. So this is what continuous data and attribute data is. It is very important to know the difference between continuous and attribute data.
And it is very important to understand what is continuous data and what is attribute data, because the tools which you are going to use in the measure and analyze phases, they depend on what type of data you are dealing with. If you are dealing with continuous data, then you might use histogram.
If I'm using continuous data, usually I'll use a histogram. Histogram means historical graph. I picked up some data historically and I'm plotting it and counting the frequencies in the bins.
If you are dealing with attribute data, you may use pie chart or Pareto charts or bar charts.
So just to the same thing. Look, I can, when I'm dealing with attribute data, I can use pie chart. This I have just drawn the pie chart for you. This was the pie chart. I can also use a bar chart. Satisfied, dissatisfied. Or if I have 5 categories: highly dissatisfied, dissatisfied, neutral, satisfied, and highly satisfied. So these will be the bar charts used. Why? Because it is patient satisfaction. It is attribute data. Okay. So this was basics. This is just the charts which we use. And now we have learned about histogram a little bit. We have learned about bar charts. We have learned about pie charts. We have learned about 2 types of data: continuous data and attribute data, and how to express, how to communicate about this data. We have understood that. Now let us go a little bit more deeper, and we can also start understanding how to analyze the data when I'm dealing with a combination of 2 types of data. Sometimes one data could be continuous, one data could be attribute, both the data could be continuous, or both the data could be attribute. In this case, what should I do? Okay. By the way, just to have a recap, we have also understood that we have got in attribute data, we can measure by proportion, we can measure by ratio, we can measure by percentage. Okay. Now, if I want to investigate, and one of the things which in CPHQ you will learn is that whenever you want to improve anything in the hospital, the best way to improve anything in the hospital or your clinic or your lab is to do improvement projects. You should be able to do improvement projects. Now, improvement projects are always done in teams. You have to train the people. You have to train the people in the tools and techniques. It could be PDCA, PDSA. It could be FMEA. It could be Lean. It could be Six Sigma. I talked about Lean by giving some examples of Lean tools also in the beginning. So it could be any methodology. You have to teach the tools and techniques to the staff members. That is the best way to change the culture of the organization. And if you change the culture of the organization, your whole job is easy as a CPHQ professional, as a certified professional in healthcare quality, as a professional. It is one of your jobs to integrate the quality, change the culture of the organization, and help the leadership to change the culture of the organization, because once the culture is established, half of the job is already done. So, well, this is what so Abdul Mabood is telling. I think attribute data behavioral indicator include along with some quantum number. Yes, you're right. So some number which we are using. Absolutely right. It is a number. So in a way, it can be quantified by using the technique of categorizing it. Yeah. By the way, one more thing I remembered with Abdul Mabood, as you rightly said. See, continuous data is also known as quantitative data, and attribute data is also known as qualitative data. There are other names. Continuous data is also known as variable data. Attribute data is also known as discrete data, because it is always expressed in discrete counts. Okay. Just wanted to add on to whatever we have learned. Now, let us go a little deeper into it. Let us learn a little bit about normal distribution, and let us learn about control charts. Okay. Once we learn about that, then we'll talk about how to deal, what type of graphs I can use when I'm having the combination of continuous and attribute, etc. Types of data. So let us go a little bit deeper into the continuous, the histogram and the average and the standard deviation. Mr. Carl Friedrich Gauss, he studied, and that was true in 17th and 18th century. There were no calculators and computers. He studied the repetitive processes. Repetitive process means like, if I go to my office every day, that's the repetitive process. Yeah. The blood pressure, my blood pressure, if I measure every day. The temperature, body temperature. Body is trying to maintain the temperature, right? The body temperature, blood pressure, or in general, height of the population. They're all examples of continuous data. And they will always follow normal distribution. And one interesting thing he found was that if you just collect 30 samples, we're talking about 30 samples only. Now, why statistically 30 sample? It is coming from something called the central limit theorem, which is beyond the scope of our CPHQ syllabus. But if you're interested, I'm happy to give you the link to my video, which explains central limit theorem. It also explains the sample size calculations. So those who are interested in going in deep into statistics, feel free to watch this video, which is called as central limit theorem and also sample size calculations. So why I'm saying 30 for continuous data, and for attribute data, it is 200 to 1100. 1100 is the very, very safe sample for attribute data. See, when the vaccine, when we are testing any vaccine before it is given to before it's released to the population, usually you test with 1,100 volunteers. Now I'm just telling 1,100 is theoretical number. It could be 2,000 also, but generally 1,100 is a guiding number. Now, from where this 1,100 is coming, I've explained this in this video, which is given just now. One video has appeared here in your chat box, central limit. Now, with a rider, I am giving you this video. This is more like, if you are interested in going deeper into statistics, you can watch this video. Otherwise, you can just safely ignore. Don't worry. It is like talking about fundamentals of whatever I'm teaching you. But yeah, coming back to our CPHQ syllabus, you need to know this normal distribution and what is Gaussian theorem. He said that every data has got an average and every data has got a standard deviation. So let us say I'm going to my hospital every day. Average waiting time is 30 minutes. And if I just borrow the same time, 35 minutes, 30 minutes, 22 minutes, etc. And standard deviation is 5 minutes. Very easy to get the standard deviation. Let me show you how easy it is. In Excel sheet, you can measure, or you can even measure in Minitab. There's a Minitab statistical software. Usually, Minitab software is used by the statisticians, but I'm just using it for the time being, just to demonstrate, because it's easier for us to learn certain tools and techniques if you use softwares. If you're interested, we generally conduct a separate session for our CPHQ holders about Minitab, and we also give you the Minitab software, by the way. But having said that, again, that is not in the syllabus of CPHQ, but in order to explain the things, I'm just using. Excel sheet also can be used to calculate the average and standard deviation, but generally these softwares which are easily available nowadays, so most of the softwares are free to use. Better use it. Why not use it, right? So if I just give you an example of, let's say, patient discharge time. I collected some patient discharge time and time taken to discharge a patient, and It is taking 300 minutes, 225, 45 minutes, 360 minutes. So I collected the samples of, let's say, 15 patients. So very easily, I can use an Excel sheet or any software or even manual calculations. Manual calculations nowadays, no one does it. But of course, we teach you the manual calculations of average and standard deviation also in our regular session. For the time being, I'm just showing you. Quickly you can get a graph, which is histogram. Average is given as 300 and standard deviation is given as 25. Very easily you can get a standard deviation. So really don't worry about the calculation part, and you'll never be asked in CPHQ examination, you'll never be asked to calculate standard deviation. But you will be given graphs, you will be given the values, you have to interpret. You have to interpret, you have to make conclusions out of it. Okay. So Mr. Gauss, he found that every distribution has an average. And interestingly, the population, and I'm talking about the population, I'm not talking about the sample. Yeah. What is sample and what is population? Let's say I treated 5,000 patients during the whole month. And I'm a large hospital, let's imagine. And I treated 5,000 patients. So 5,000 patients are the population. Out of that, I collected 50 samples. So sample is the 50. Now, if I collect 50 samples or maybe 30, theoretically 30 samples, and take an average and standard deviation, I can predict about the whole population. I can predict about all the 5,000 patients. And that's the I would say, surprising phenomenon or a surprising fact. So in a way, what I'm trying to tell you is that you can predict about a large population, 5,000, 50,000, 5 million, 50 million, doesn't matter, by using Gaussian theorem. What is the Gaussian theorem? He said that plus 1 sigma, plus 2 sigma, and plus 3 times standard deviation, and minus 1 times standard deviation, minus 2 times standard deviation, minus 3 times standard deviation, plus minus 3 times standard deviation lies in 99.73% of the population, or 99% you can say. 99% of the population lies between plus and minus 3 times the standard deviations. And why it happens? It happens. It's a phenomena. It's an observation. If I collect the blood pressure of 30 people, 30 healthy people, I will get average and standard deviation. I can predict about the whole population, all the healthy people. Yeah. If I calculate the height of all the 5-year-old children, 30 children, average height I'll get, standard deviation I'll get, and I can predict about all the children in the world, or maybe from wherever I have taken the sample, and I can make these predictions. So I'm using Gaussian theorem. Now, these normal distributions exist in the nature. They exist. They are there. Only thing is we are not aware of it, or we are not using them. That's a different thing. But yeah, most of the researchers, they use. They are aware of it. Now, have you understood this up to here? Are you with me? Just let me know. Are you with me? I'll switch on my fan. 1 minute. Yes, Muhammad Asad, thanks. Rosina, Huma, thanks. Oh, yeah. So when people keep telling, I understand people are out there. Muhammad and Talat Naz, Sheena, thank you. Thanks a lot. Great, great. So, Safia, thank you. So now, if I take the example of me traveling to hospital, so this becomes 30 minutes. 1 time standard deviation will be 35 minutes. Yeah. 2 times standard deviation will be 40 minutes, and 3 times standard deviation will be 45 minutes. Similarly, I can predict about here also, minus 1 time standard deviation will be 25 minutes, 20 minutes, and 15 minutes. Okay. So this is lower control limit and this is upper control limit. The very favorite question about in the CPHQ examination now. One or two questions generally, because these are like considered to be tough. See, 20 questions will be around very tough. 50, 60 questions will be okay, moderate. And around remaining questions will be very, very simple. Yeah. So the one which I'm covering is like one of the toughest questions. It's about control charts. Okay. So first of all, please understand this 15 is known as lower control limit and 45 is known as upper control limit. LCL and UCL. Okay. LCL and UCL is something which is present for any process, any repetitive process, like you're treating the patients, patient treatment. It has got an average, it has got a standard deviation, it will have a control limit, it will have its own control limits. Number of customer complaints. On an average, you are receiving 30 customer complaints, standard deviation is 5. In a way, actually, customer complaints is attributed. So I would use another distribution, but don't worry about it. I'm trying to explain one concept to you, so you can use that. So on an average, 30 complaints I receive, but it never goes below 15. 15 is minimum customer complaints I have. And maximum customer complaints I have got 45. Patient waiting time. Average 30 minutes, standard deviation, standard 5 minutes. So I can predict about all the patients waiting time. That patients definitely is going, if he comes to my hospital, he is going to wait for minimum 15 minutes, maximum 45. So I'm trying to project this whole concept to 2-3 different processes just to make you understand that this is present everywhere. So control limits exist. We also call them as voice of process, as if process is trying to speak to us. Process of traveling to my hospital here. It's telling me, it's trying to tell me that I'm taking between 15 to 45 minutes. Now, if you look at on a time scale, my process will look something like this. If I take example of traveling to my office every day, sometimes I'll take 30 minutes, sometimes I'll take 35 minutes, sometimes I'll take 25 minutes, and so on and so forth. This we call it as natural variation. Natural variation. Let me use, can I use a video like to explain this concept? Your permission, up to you. By the way, all these videos are available on our Anexas YouTube channel. You can always subscribe to this channel. Please do subscribe. Always good. You'll get pure knowledge, pure statistical knowledge, pure process improvement knowledge. Although I'm into healthcare, artificial intelligence, and machine learning as well. And I've got a very good 2-hour introduction to machine learning in healthcare, artificial intelligence in healthcare. Please do watch that. Please do watch that video whenever you have time. Although I'm trying to tell you something more than other than CPHQ, but as a healthcare professional, it's always better to keep always you should be new. You should get all the new knowledge from everywhere. So please do watch that video. I'll put that video also. Okay. Yeah. So this is the video. This is the video my team members already put in here. Okay, coming back. This is known as. So if you are fine with if I use my video, let me show that video. Thank you for giving me the permission to use the video. Sometimes things become easier. Let me explain this part. Yes. So there, when it's video is being shot, your handwriting is a little better, right? You try to be very clear.
So if you want to change, if you want to make changes, go ahead with it. And your data collection plan should be such that on an average, I'm taking, take a simple example. Suppose I collect the data of my travel time from my home to office every day. And I find that on an average, I'm taking 30 minutes and standard deviation is 5 minutes. And we know how to calculate the standard deviation and how to calculate the average. Now, if I plot the data on a histogram, then lower control limit would be minus 3 sigma limits, that will be 15 minutes, and upper control limit would be 45 minutes, that is plus 3 times the standard deviation. So lower control limit being 15 and upper control limit being 45, I can say that my travel time is going to vary between 15 to 45 minutes. So you can expect me to travel to my office every day between 15 to 45 minutes. If someone asks me why this variation between 15 to 45 minutes is there, I can tell him that it is due to common cause variation. What is common cause variation? I can say that the variation between 15 to 45 minutes is due to lots of factors. These factors can be the traffic on the road, the weather, the car I use, my mood, or it can also depend on at what time I start from my home. So a lot of factors, which we can call it as X factors, are affecting the travel time, which is the Y here. So I can make the statement that the variation between 15 minutes to 45 minutes is due to the common causes.
So, in statistics, when we draw the control chart, the points within the control limits, we call it as, if they are within the control limits always, we call it as processes under control. Means processes behaving as per the expectation. I expected. Now, this is not like as per the customer. See, process under control just means that it is predictable. Yeah, it is predictable. Like if I convert this 15 minutes, 40 minutes, like it's a number of customer complaints. 15 to 45 customer complaints, I am expecting. This is predictable. In my hospital, we get minimum 15 complaints and maximum 45 complaints. Usually on a given day, we'll get a number of complaints will be between 15 to 45 minutes. The way I'm saying, on a given day, my travel time will be somewhere between 15 to 45 minutes. It's predictable. If I am behaving within that range, I say I am under control. Now, under control doesn't mean that the customer is happy. Please remember that. The customer gives you another limit, which we call it a specification limit. I was talking about control limit here, LCL, UCL, lower control limit, upper control limit, LCL, UCL, right? That is different. There is customer specification limit. Customer is specified. For example, like if this is waiting time, 15 minutes to 45 minutes. This is my present waiting time, but the customer wants not more than 10 minutes. So the 10 minutes becomes the specification limit. So please remember, specification limits and customer control limits are different. Okay. Now let us move ahead.
Means all the causes are acting on my system and producing this variation. This is known as voice of process, as if my process is telling, my traveling process is telling that I will take between 15 minutes to 45 minutes. Now, if I take 60 minutes to travel to my office, then same question is asked to me, that why did I take 60 minutes? Then my answer won't be that all the causes are acting on my system and producing this variation of 60 minutes. I might be able to point out a cause. We call it a special cause. So I may say that I took 60 minutes because maybe today there was too much traffic on the road, or it can be any factor. So when I go out of control limits, I can specify a special cause, and we call this variation as a special cause variation. So we have two types of variation: common cause variation and special cause variation. Common cause variation is part of the process, part of the natural variation of the process. And special cause variation is assignable variation. I can assign a cause to that particular event. Now, what is the difference between common causes and special causes? For special causes, you need to take immediate action. Means you need to take a prompt action so that you are able to bring the process within control. But for common causes, you should not take any specific action. Usually, the common cause is within the control limits, and if you want to act upon the common causes, you might have to change the control limits, and changing the control limits takes effort. You may have to do a DMAC project. You may have to do a lean project. You may have to do a Six Sigma project. And that's what we are doing. That is why we say that lean and Six Sigma is applied to chronic problems. A process is behaving in a certain way. It is behaving within some control limits for a long, long time. Last 6 months or 7 months, your procurement time has been, say, 120 days plus minus 30 days. And I would like to change the control limit. I would like to change the DNA of my process. And that is why I would need to do a Six Sigma project.
So any process improvement project in CPHQ, you learn how to improve the project. And the projects are the best way to, as I told you earlier, are the best ways to improve anything. And what is the definition of a project? It is a starting point. It is an end point. It is done in team. So just to repeat, whatever I said, any process has got control limits, which easily we can find out by collecting 30 samples. Now, if I want to change, like say, for example, it is waiting time. What is my intention? To change the process to new control limits. So don't waste your energy and time just by monitoring, these values. They are going to naturally vary, and don't assign a cause. Don't try to assign a cause to this. It could be anything like, even infection rate, number of customer complaints, number of patients visiting. If you're a private hospital, then daily revenues, daily billing collections, all these things, they will follow normal distribution, and this variation, common cause variation, will be always present. Yeah. So don't feel too happy with this kind or sad with this kind of variation. Sometimes, let's say, if I take an example of customer complaints, patient complaints, right? This is our patient complaint, and one fine day we find that we have got lowest. On an average, we are receiving 30 patient complaints. But this time, we have got only 16 this day, lowest ever. And we are celebrating like, wow, we have really improved. But the next day, you can expect it will be higher. So this natural variation, if you try to, think too much about it, you're going to waste your time. What you should be focusing on are the control limits. This is your control limits, and your aim should be to make it between 0 to, let's say, I'm just taking an example, between 10, 0 to 10. And this is what is known as a real improvement. And these projects will change the culture of your organization. And then it will improve the patient patient safety, improve the quality of your healthcare, also increase the population health. It will also, reduce the risks to the hospital, and it will also help you to get the respective accreditation, because one of the important consideration of all healthcare accreditations is that you should be continuously improving. Continuous improvement demonstration should be there. So so I think this was one of the things. One more thing, let me ask you now question, CPHQ question. Okay. Tell me, is this process under control? Is this process under control? No, yeah, you're right. No, it's not. Okay. So there is a special cause. What should I do? I should investigate. Yeah. Now, let me, although I have not covered, but some of you might be knowing. Is this process under control? Okay, so now I played a trick here. I did not tell you that. So, okay. So in a way, theoretically, you will say yes. But one more thing. The process may not be under control. See, what we are trying to look for is a special cause. So although here it is a lower and upper control limit, but one more thing to make the process under control is that it should be showing random variation. See, randomness is one thing which can be predicted in the nature very easily. Randomness is one thing which can be predicted in the nature. Nothing else can be predicted. Okay. If I'm trying to predict events, randomness only I can predict. But if we see a pattern, that means something special is happening. So if you see here, continuously 1, 2, 3, 4, 5, it is increasing. No. See, if there's a pattern, again, we'll say that it is not under control. So one thing is point outside the control limits. Another is if there is a pattern. See, examples of pattern could be this. One up, one down, one up, one down, one up, 14 times up and down, up and down, up and down. That means something special is happening in this process. There's some cause. Something, I need to investigate. Similarly, increasing, it cannot happen. Something I need to investigate. So whenever there is a trend, they are all based on the probabilities. Okay. So there's one more thing. There's one more chart, which is before control chart. In very simpler chart one is known as run chart. Run chart means what? I just plot the data. Without any control limits, I just plot the data. It could be anything like patient discharge time. It could be your waiting time or number of patients visiting the hospital, etc. There is no control limit here. I can draw a median. Median means which is dividing the whole data into two equal parts. Yeah. So 50% of the data lies above and 50% of the data lies below. That is known as median. So there also, if there are random patterns, that means we'll say, okay, fine, this is a normal process. Normal in the sense doesn't mean a good process. Please understand this. Normal distribution doesn't mean like a process is good. Process is predictable. That just means that. So if there are too many runs means, see, this is one run, this is second run, this is third run, this is fourth run. Whenever the line is crossing the median, whenever going from lower to upper or upper to lower, halves, because median is dividing the data into two halves. Right? It is known as run. So if there are too many runs also, like this is known as too many runs. There are too many runs. This is something, something special is happening in the process. There are clusters like something like this. Let me plot a new chart. Yeah, let me plot it here. Okay. This is the median. And so there is a cluster here. Okay. So all these things show that something is happening which I need to investigate. It is all based on the probability. There is no, there are two things. I can demonstrate it using a game. If you want, you can play a game of head and tail with me. And one of you can toss the coin. And I'll trust that, you will tell me the real values, head or tails. So anyone who's ready, if it's handy, anyone is having the coin handy with you, head and tails, I can demonstrate the control charts and these rules of 6 or randomness using that game. This will ensure, and you'll understand why we are telling when there is up down pattern or continuous up pattern, then in that case, why the process is out of control. So anyone has that coin, just let me know. If anyone has the coin, we can quickly, and I will predict, I don't know, like I'll try to predict the outcomes using again statistics. And I will tell you the trick also. Next time when you play the game, you can also predict. No big deal. Okay, you have Muhammad Asad Nawaz is telling I have got. Okay, so just flip the coin. Now, don't start flipping the coin. Just hold the coin, and you have to flip the coin, and you have to allow it to fall on a table or some place. Okay, and you have to tell whether it's heads or tails, heads or tails. So when I say, then you start playing. And also to make the game interesting, let me also do some predictions. If you get 10 out of 10 heads, I'll give you $1 million. Okay. Virtual game, virtual money. If you get 9 out of 10 heads, I'll give you, let's say, $10,000 or 10,000 reals. If you give me 8 out of 10 heads, I'll not give you anything. Nothing. Yeah. Now, see, actually, I have already played this game. I have collected the data many times. I know on an average, you will give me 5 heads. And at the most, you'll give me 8, or at the most, you'll give me 3. Okay. So please start playing the game and flip the coin. And you are going to give me between 3 to 8. Yeah. So please tell me what is the first one. And even if you get tails, don't worry, we'll still play 10 times. Okay. Because I want to give you some information about the control charts. Yeah. So one heads, oh, you are lucky. Okay. Next one. Flip the coin one more time. Oh, tail. Doesn't matter. Continue playing the game. Next one. So see, as I said, all processes, they follow this randomness. All processes. Tail. Okay. Please continue. So head. Now tail. The tail. Now let us see. Tail. Now you are likely to give me heads. Please go ahead. In fact, it would have been good that we had camera also, so people would have watched it, but it's okay. It's head. See? And by the way, Mr. Muhammad is not my person. He's a participant, let me tell you. And I'll tell you also why I could predict, which is very easy. I'll tell you in a short while. Now, yeah, please go ahead. Now, in the next 3, 4, 5, in the next 5, you will give me more of heads, as compared to tails. So it was head, again head. Is it after head again? Okay, yeah. Then tail, okay. Then head, okay. The next one, head, okay. And again head. I also told you in the next 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I told you here, in the next 5, you are going to give me more of heads. And you gave me more of heads. Now, how could I predict? Now, some of you might have guessed. Only thing I can predict, if you remember, only thing I can predict is randomness. So I'm looking for randomness. So when you give me continuously 3 tails, by the way, if you give me after heads, if you play, you will get tails. Oh, you have already told me. You should not have told. Okay, tails. How could I predict this? Tail, 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 continuously tail, tail, tail. Oh, 3 times is okay, but 4 times very highly unlikely. Okay. In the first part, I have already got only 2 heads. I need to get more of heads to balance, isn't it? So I predicted more of heads. Here, because 3 heads you gave, I could predict it is tails. Now you play this game, on your own later on, and you will find that, most of your 90% of your predictions will be true, and people will be surprised, But there's no surprising, this nature. This is how all processes behave. And this is what statisticians teach. This is what statistics or quality teaches you. By the way, here I got how many heads? 1, 2, 3, 4, 5, 6. 6 heads I got. Now, if you continue playing, you will always get sometimes 4, sometimes up, down, 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 up. This also will follow the randomization. So this randomization is everywhere. Okay, great. Now we have learned a very good topic of a run chart, control chart, how to predict processes under control, out of control. Is there any special cause or no, common cause? Now, surprisingly, all our processes, they follow these control charts. All our processes have got vice of process, control limits. Every process has got so many processes. Time taken to make a lab report follows normal distribution. It has our control limits. But we don't have time to collect even 30 samples, and we don't even understand our processes. We are working there for 10 years, but we never draw a control chart and see what a control chart can make a difference. You can start predicting a process and, find the special cause. You can investigate it. And when you have got common causes, then you can take a improvement project, right? You can take an improvement project to change the control limits. This is what is known as statistical thinking. Well, now let me, as promised, let me also tell you now. I told you earlier, there are two types of data. How to deal? I told you if it is continuous, make continuous, histogram. Now, if it is a combination, see, when we are doing root cause investigation, let me take an example of, let's say, patient discharge time. Why the patient discharge time is high? First, I drew a histogram. I found it is, now let's do one more time. That average is, say, 300 minutes, and standard deviation is 25 minutes. And I can even do a control chart here. I'm just showing you. No one is going to ask you these questions about the software or how to do these charts. You'll be given the chart. You'll be given the chart and you have to interpret. That's it. But I'm showing you how so that you understand the thing. That's very important. If you understand, you will not take too much time in answering the question. You have got only 2.5 minutes to answer a question, 3 minutes at the most, 3 to 4 minutes. So if your fundamentals are not strong, you'll just read the question, try to make a guess or try to recall something. By the time your 3-4 minutes are already gone, and then this is not expected from a person who's appearing for the exams. Also, one more thing, if you're not interested in appearing for the exam, no problem. You still get a certified healthcare quality expert certificate after you attend the session. You still get certified healthcare quality expert, which is also valuable. But when you appear for the exam, then you get CPHQ. Okay, great. So 300 minutes. This is what the control limits are for my patient discharge time. Now, why this patient discharge time is high? So I can make a cause and effect diagram. Cause and effect diagram, you have to brainstorm on man, machine, material, methods, and you have to use brainstorming. See, brainstorming is used to find possible root causes. Brainstorming is used to get your ideas to improve any process. So brainstorming is used in multiple places, multiple cases, right? Multiple cases. Let me give you some basic rules of brainstorming. 1 or 2 questions might be asked about brainstorming. They may give you some, scenarios, and then they will expect you to answer these questions. So let me
Once we have
Okay, let me show you.
with at least 4 levels of depth for that the first brainstorming is not done to find the solutions to our problems, but to brainstorm on the possible root causes. The purpose of brainstorming is a method of generating lots of ideas quickly by encouraging the creativity. It also involves lots of people, and it also generates excitement and energy within the team members, and it separates the people from ideas they suggest. There are certain prerequisites of conducting a brainstorming session. They are very simple, but they should not be ignored. First, the purpose of brainstorming should be clear to everyone who is participating in the brainstorming. So it's better to give them the topic, tell them what exactly is the purpose of brainstorming in advance. Participants should be from the process or may not be from the process. You may also like to invite the people from other departments to get a fresh perspective. You should also have a facilitator. Facilitator is generally the person who is not participating in the brainstorming. Means he's not participating in generating the ideas, but he or she is facilitating the whole session. Usually he or she can be a consultant or a person from another department, or one of the persons from the team can act as a facilitator. You should also have stationery, and you should also use the appropriate tool of brainstorming. So there are different brainstorming techniques we will be learning in improve phase. You can use either of them. You should have a meeting room and flip charts and other facilities, whatever is required to conduct a brainstorming session. And you should also communicate to the participants about the time, venue, topic well in advance, so they are mentally prepared for brainstorming. As I told you that brainstorming is used for either generating the possible root causes or getting the ideas to solve the problems, there are certain rules which need to be followed in brainstorming. The rules of brainstorming are: give equal opportunity to everyone who is participating. So tell them to participate, and you can use different techniques. As I told you, we will be learning in the improve phase. Capture all the ideas, so document all the ideas, whatever is being discussed, whatever ideas the participants are given, someone should be there to document, or a scribe you can appoint to document all the ideas. Leave your designation and ego along with your shoes outside the meeting room. That means don't think that if you are senior, your idea carries more weightage. So obviously this ground rule should be very clear to everyone, and everyone should be encouraged to give an idea, and everyone's idea should carry equal weightage. There should be a non-threatening environment. When people are giving ideas, they should not be afraid of giving ideas. So you should create an environment where people should be encouraged to give the ideas. Also, we should ensure that wherever the brainstorming is taking place, there should not be any disturbance, so people are focused on brainstorming. Sometimes people might deviate from the topics. There is a tendency that some important issue crops up during the discussion. So at that time, you can always create a parking lot saying that, well, this idea or this issue is very, very important, and we can park it to be discussed after a while once we complete the brainstorming on this particular topic. We should encourage people to fantasize freely. We should not put brakes on our thoughts. So you can give some out-of-the-box ideas, you can give some wild ideas, and if people are giving you wild ideas, they should be encouraged. If you give a specific duration of brainstorming, we should try to complete the brainstorming within the time duration, and defer evaluation. Now this is one of the rules which is often violated. People start discussing the ideas. Someone gives an idea and someone else says, well, it will not work in an organization. Or some other person gives an idea and someone else comments that, wow, it's a great idea. So don't evaluate. Reserve your comments for evaluation at a later stage. When you are generating the idea, when you are generating the root causes, they are not to be evaluated. You cannot say that it is a good idea or this is a very good root cause which you have thought of. No evaluation, just write down whatever is being suggested. Generate quantity, do not worry about the quality at the initial stages. So you have to generate lots of root causes, lots of solutions, more the better. A pearl diver, he dives into the sea to find the pearls. If he just collects 10 oysters, the probability of getting the pearl is very low. But if he collects thousands of oysters, the probability of getting the pearl is very high. So similarly, if you want to collect great ideas, some of the out-of-the-box ideas, some creative ideas, then definitely you should create more and more ideas. So how to generate those ideas? There are different techniques. Some of these techniques we'll be discussing in our improve phase. But right now, we are in analyze phase. And as I told you, either you are using cause and effect or tree diagram, you can use brainstorming. And the first brainstorming is, interestingly, to find the root causes. We can use brainstorming to generate a Well, there is no special training, no job.
So there is one more tool called 5 why analysis. Let me talk about 5 why analysis as well.
A lot of potential causes of the problems you defined in measure phase. You can use why to push for root causes. To push for root causes, start with your focused problem and then ask why several times. For example, focused problem could be customers complain about waiting too long to get connected to staff during lunch hours. You can ask why 5 times. Why does this problem happen? Because backup operators take longer to connect callers. Why? Because backup operators don't know the job as well as the regular operator or receptionists do. But why don't operators know the job well? Well, there is no special training. No job aids make up for the gap in experience and on-the-job learning for the backups. Why? Because in the past, the organization has not recognized the need. But why? Because the organization has no system to identify training needs. So this becomes the root cause. 5 why becomes a way of mild deep thinking.
That was about 5 why, and then you can use a cause and effect diagram. Cause and effect diagram is talking about, generally trying to make a chart, or make a, not a chart, basically a fishbone diagram, also known as fishbone diagram, and try to brainstorm. Now this, like your choice, you want to brainstorm on 6 branches, or you can have your own branches also. But this is for man, machine, material, method, and measurement. And just to make it M, we can make it Mother Nature. Environment, yeah, environment, yeah, or Mother Nature, just to make it M if you want, like 6 M's technique, as they call it. Now these are to help you generate this, generate the possible causes, because generally if you ask anyone why this problem is there, they'll generally say, they'll blame the people. And most of the time they will blame the people. They say, well, people are not skilled, people don't want to work, they're lazy, etc. But Ishikawa diagram, this is also known as Ishikawa diagram. Ishikawa was the first person who gave us this diagram. He said that apart from people, there are lots of other factors, which are responsible for the problems. So try to brainstorm on those causes. So let's assume we brainstormed on it and we collected this data, man-related causes of our patient discharge time. I'm just trying to show this patient discharge time example. Man, machine, material, method, measurement, environment. And I draw a cause and effect diagram. You can draw manually also, or you can use the one software which I'm using right now, which also can be easily downloaded. Go to minitab.com, you can download it. Okay, but when you come to our session, we'll teach you properly, the whole. And I have to just invite you to my session also. My team is telling that don't forget them to invite into the session. So, well, I'm inviting you to the session as well. And please join my session. If you join today, there's a special offer going on. Typically, it takes the CPHQ courses are priced at 2,000 dirhams, or reals. But if you join today, it's just 1,000. It's just 1,000 if you join today. This is our foundation month. On 28th of July, we are having a very good celebration. So, you can always join that celebration. And this is our. So before I proceed, I'll continue with the cause and effect diagram, etc. But my team just reminded me that some people are asking as well. So if you are interested, you can. Okay, let me ask you, how many of you are interested? Let me ask you. Yeah. One question, if you can just answer this poll. So if you are interested, we'll be definitely sending you all the details of our program. I'll tell you the dates also. Next weekend batches are starting on July 29th. On Saturdays. Generally, we have training sessions on Saturdays. So this weekend batch is starting on Saturdays. It's all Saturdays. Saturday. We have got 4 Saturdays. Usually, if we are not, sometimes we extend the program to 5 Saturdays also. So if you are interested, please let us know. Okay, great. So this is the forthcoming program in just 8 days. And also, please attend our 20th July. We also give Process Excellence Award to some very good projects done in healthcare in various domains. And we also have some good panel discussion on future of quality and how you can shape a better future with quality. So please join us. So I just wanted to invite, and so a special offer, 1,000. These are the different agenda which we'll be covering. Day one is quality leadership and integration. We'll talk about strategic planning and stakeholder engagement. Then go to the next one, performance process improvement. All the topics we'll be covering. Again, it's all aligned with the NHQ material, population, healthcare, and data transitions. Then after that, we'll be covering health data analysis, analytics, and then after that, we'll cover the measurement and analysis. Some of them I'm going to now talk about in short while. And also patient safety. And then after that, quality review and accountability. Okay, so these are all very, very, this regulatory and accreditation also. So these are all topics which are very relevant to any healthcare company. And even though you're not planning to go for CPHQ session, but exam, but you can even go for, once you complete this session, you'll get CHQE certificate, Certified Healthcare Quality Experts. So it's something which is really nice to have. These are the timings of, so if you want to join, please let us know. Now, let me continue our sessions, please. Yeah, so invitation, yeah. These are some of our free upcoming webinars also. Yeah. So I'd like to invite you to our sessions in the future as well. Okay, now let me take you back. Yeah, so cause and effect diagram. Now, see, all the causes are not going to be equally responsible. One gentleman called Pareto, again 17th and 18th century, he found that 80% of the wealth in Italy, he was an Italian economist called Vilfredo Pareto, he found that 80% of the wealth in Italy was with 20% of the people, and he called this as 80-20 rule. 80-20 rule means 80% of the money with 20% of the people. So Joseph Juran applied this to quality, and he said 80% of the problem, whatever here the problem is discharge time delay. 80% of the problem, 80% of the delays are due to 20% of the causes. So if we've got 20 causes, 20% of 20 is 4. So only 4 causes would be responsible for your patient discharge delay. So better find which of them are responsible. So you will list down all the reasons of from your cause and effect diagram and find which reason is occurring most frequently. So you can see that reporting are not accurate. If you collect the reasons here, they've collected the reasons of the delay. Every discharge, which was like a patient discharge, which was delayed, we are actually collecting the data. So frequency, we got it. And some of the causes will be appearing too many times. They'll be way too ahead of others, so as to say. So I can do a Pareto analysis. Means I arrange the reasons in the descending order. I arrange the reasons in the descending orders. In Pareto, quality tool Pareto charts. And I can see that, well, 29% approximately is contributed where reporting is not accurate or staff not available. It's 25% contribution. So both together, 29 plus 25 are contributing as 54. So this is the line which is the sum total of the causes. Like first two causes, it's coming up to here. First three cause, okay, this much. First four cause. So you can see around first four causes are almost contributing to 80% of all your problems. First four causes are contributing to almost 80% of your problems. Okay. So rather than focusing on all the causes, I'll just focus on these four causes. Now, out of them also, some causes would be like we can validate those causes using further investigation. So what we did, we collected further data, right? We found reporting accuracy may be impacting, might be impacting our patient discharge time. When reports are accurate or not, if they are not accurate, it delays. Whether it really does delay, we have to see. So here I can do some charts. I'll tell you which chart. See, reporting accurate or not accurate and discharge time, it's a combination of continuous data and attribute data. Reporting accuracy is the attribute. Correct, incorrect, that is attribute. And patient discharge time is continuous. So in that case, I will use something called as box plot. So let me explain it, here. So I'll go back here. So we have two types of data, continuous and attribute. What I'm trying to explain here is whenever this is patient discharge time, right? Discharge time, which generally we designate as Y. And the reporting accuracy is, let's say, method. I'll put in method. Reports accuracy. Reporting accuracy is attribute, right? It is not continuous data. Reports accurate or not accurate. So I'm trying to establish a relationship between the two. Is reporting accuracy affecting my patient discharge time? Well, this is patient discharge time in the y-axis. Reports are accurate. Reports are inaccurate. Accurate reports taking less time, inaccurate reports taking more time. Yeah, so you collect the data. The box plot typically looks like this. Now, what is a box plot and details of how to draw a box plot and what are these are all known as quadrants. This is known as median. So all the details, if you are interested, I have got a video explaining the box plot. So I'll put that video also in your chat box. And we'll also put all these videos in your email. The email also you'll receive. By the way, the easiest way is just click on subscribe button to our YouTube channel. Anexas is the YouTube channel, and you'll get all these information for free in sequential order. And you'll also get access to our training recording, today's training recording as well. Plus also you can get access to a lot of training material. But anyway, now I was just trying to explain to you what is box plot. So box plot is something which can be used when I'm dealing with continuous and attribute data. So my team, if you can put the box plot video also, that will be of great help. So now here, look at this. What do you think? Reporting accuracy, is it affecting the discharge time. When the reports are accurate, it is taking less time. Not accurate, it is taking more time. That means I should work on reporting accuracy, and that will help me to reduce the time. But suppose this was the case. Let me, take a hypothetical example, same thing. Reports are accurate or inaccurate. Now, minute difference is there, but do you think, see, when I have got accurate reports also, still I take, say, patient gets discharged in maybe 400 minutes. And when I have accurate or inaccurate, see, the range is almost same. Then I would say, well, accuracy is not the root cause. Maybe something else is the root cause. Maybe something else is impact. Maybe the patient discharge summary is being written, it is taking a long time to write. So we will investigate other root cause rather than focusing on only this. Say, for example, this one. Let me talk about patient discharge time. Okay. So no, discharge summary time. Let us investigate the discharge summary time. Let's say this is this delay is actually affecting my patient discharge time. Is it really? I want to investigate the relationship between the two. Now, discharge summary time and discharge time both are continuous data. Okay, so I cannot make a box plot. Then I will make a scatter plot. Something like this. So this is discharge time of the patient. This is discharge summary time, making time taken to make discharge summary time. And generally, you'll see this trend. More time I take to make a discharge summary, it delays my patient discharge time. So that means I will say, yes, they are positively correlated. And in order to reduce my discharge time, I can work on, this is my root cause. If I reduce the discharge summary time, making the discharge summary time, it will reduce my discharge time. But suppose this was the case. Doctors write the discharge summary within 20 minutes, but still I take 4 or 5 hours. Still, always patients take around 4 to 5 hours. That doctor writes in 30 minutes or 60 minutes, it hardly matters. Means in that case, the discharge time is actually it's not affected by the discharge summary. So all these things, they are, you can investigate using different tools and techniques. And I just wanted, okay, let me demonstrate before I leave, before I start asking the question. See, I'm open to answering your questions. Yeah. So let me demonstrate, like here, discharge time and discharge summary time, delay time. What I will do, I'll do a scatter plot. So let me do a scatter plot. Okay. Well, they are related. Okay. So if I focus on how to reduce the discharge summary delay, I can easily I'll easily reduce the discharge time. Similarly, discharge summary time and pharmacy time taken to get the medicines, etc., or time taken by the pharmacy. Is it related? Let us do that as well. Let us plot this data of discharge, pharmacy time. Okay. Not related. Pharmacy takes 15 minutes, 20 minutes, or 30 minutes, 40 minutes, 50 minutes. It hardly matters. There's no pattern there. there's no, I can't say that, pharmacy time is actually the real cost. We're not saying that it is not affecting at all. We're not saying that, but it is not the root cause. Yeah, it is not the root. Just don't waste your time in improving the pharmacy-related process and imagining the patient will start getting discharged sooner. No. Similarly, discharge time versus reporting accuracy. I can do a box plot. Okay. Oh, this is about staff availability. Sorry. So this I've done it for staff availability. Staff is available or not available. Availability of staff. This one attribute and discharge time is continuous. I'll do the box plot. And obviously the box plot showed they are almost same, so it is not impacting. But let me do the one for reporting accuracy. The reporting accuracy. It appears that reports are accurate. It takes less time. So yeah, so this was all about just wanted to tell a little bit of data analytics. I hope it was not too much. For 2 hours, I tried to give you lots of knowledge, but I hope you enjoyed the session, and I also enjoyed, despite a little bit of after the coffee, I was a little better, but still, it takes, as I said, 3 to 5 days to solve the throat related issues. So I'm going to take that much of time, but I'm sure you gained a lot of knowledge today. And feel free to watch my videos in Anexas YouTube channel. And yeah, if you are interested, I'm waiting for you to join my CPHQ sessions. You'll learn a lot of things. I also conduct the green belt and black belt training for Lean Six Sigma, and that is also very, very popular in the healthcare. I have also conducted lots of training programs for Ministry of Health. So you can always connect with me on LinkedIn. If you are on Facebook, maybe Facebook page also to you, Instagram, etc. Generally, LinkedIn, I keep posting lots of videos as well, which are related to quality. Okay, any questions we have before I show some videos? Okay. Until the time you're asking question, let me show you 1 or 2 projects also. So in Six Sigma, actually, we use DMAC approach: define, measure, analyze, improve, and control. So Six Sigma, you'll be learning a little bit in CPHQ as well. So just now I told you the rules. So if I was just making 1 column and I'm trying to analyze the data, if it is variable or continuous data, I'll use histogram or graphical summary. And if it's attribute data, I'll use Pareto chart. Then if I'm dealing with 2 factors, one is continuous, one is attribute, I'll use box plot. Both are continuous, I'll use a scatter plot. And one is attribute and one is continuous, or sorry, both are attribute, I'll use a Pareto chart. These were some basic elements of data analysis. I'll show you a Six Sigma project, DMAC, define, measure, analyze, implement, control. Define phase, you write a project charter, write a problem statement and a goal statement, what you want to achieve. And after that, you measure. You also do a SIPOC, supplier input, process output, and customer SIPOC. And after that, once you have done your SIPOC, you write the charter where you want to achieve or what you want to accomplish. So first is like, what is the status? What is your current status, which is one histogram will give. And what is the should be? Afterwards, in the improve phase, we'll come out with the should be process map. And then what we should be doing to achieve a better state So what will be our control limits before and after? That also we have to project. Cause and effect diagram, and then we do a Pareto. And once you do a Pareto, you get the root causes, and great. Once you attack the root causes, you get the full picture of improvements. And don't forget this before and after graphs, before and after the improvements. Great. So that was about, I think, all for the day. I also, one more thing is there. You just learn FME, failure modes and effects analysis. Please learn. Please do learn. And I'll request, today, imagine this training is continuing and for another 20 minutes. And this video is about for 20 minutes. And it will teach you a wonderful tool called FMEA, failure modes and effects analysis. I've taken a very simple example. Again, going to hospital or going to office. And I've tried to drive home some points there. And FMEA is one I strongly recommend that. FMEA is anyway part of the CPHQ also. And FMEA is something which we should be using more often. So I'm personally open to, if you need any help in doing all these, using all these tools and techniques, I'll be happy to help you. And FMEA being one of them. And FMEA, please, 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 this is the most important one. Okay, great. Any questions? Here.
Mr. Andrew Robertson with us, who's CEO of King Edward VII Hospital in London. And we would like to know from Andrew that what does quality mean?
Similarly, we have got Deputy Health Minister of yes, talking about.
We have Dr. Tarif Alama with us.
And so a lot of people have undergone.
Let's finish the course.
Oman. Then we have got Vietnam, Russia, America, China. So we've done lots of trainings in various countries. And yep, it's real value if you join our sessions. So once again, requesting you to join my sessions. Yeah, and feel free to ask questions. Thank you, Sheena, for for your comments. Thank you. So if there are no questions, then we can wind up. Okay, one more question is there. Okay. And no, there are not. Okay, so please watch these. Please watch these sessions. Okay, and thanks a lot. So see you then in the training room. Those who have registered and those who have not registered, stay in touch. Basically, stay in touch, and you can think over, and you can just express your intention and your offer of 1,000 dirhams. Actually, it ends today or maybe tomorrow, but yeah, why not try? Give it a try. Okay, one question is there. But Janet she's asking, out of what number of population should we use the rule of thumb for attribute data, which is 22, not 20, 200 to 1,100? Yeah. So it is not affected by the population, by the way. It has nothing to do with the population. So go for 200. Just go for 200 to 300. That's good enough. Are you the Janet from our team, AccuPro, by any chance? Oh, yes. Oh, hi, Janet. Hi. Okay. Yeah. So, by the way, also, I'll tell you, everyone, that we have got around more than 70 people present here. I would like to tell you that we also have a accreditation software and an accreditation services of our sister company called AccrePro, who are into, we help the organizations, we help the hospitals to get the accreditation faster. And we have automated lots of things, lots of processes. And if you're interested in knowing more about it, feel free to connect with us. We'll help you to, our AccrePro team will be happy to make a good presentation to all of you. Yes. So if you're interested in how we can help you in accreditation process, just even write to us. Okay, great. Okay, one person is asking what exactly you're saying. Okay, in Q&A. Sir, your introduction, I missed the initial time. Oh, okay. Okay. Oh, and another thing, Amar Muhammad Singh, can ISO 9001 helpful? See, ISO 9000 will establish the system, establish the processes. But the improvement part is helpful using all these techniques. So ISO 9000 will help you to understand, to establish the SOPs, standard operating procedures, systems in place. So we call it as quality management system, but Lean, Six Sigma, they are all improving your processes, right? How many times we can attempt the exam in a year in our okay, I think 2 times or 3 times. Yes. But okay, you are talking about like there is a window. Every 3 months there is a window of around 15 to 20 days. During that window, you can appear for the exam. My introduction. Okay, so you missed out. So I'm actually. I give a very long introduction, in fact, in the beginning. But if you are interested, a short one, I'm a chemical engineer originally, MBA finance, then a data scientist, then a CPHQ, then a PMP, then a Lean Six Sigma Master Black Belt, and lots of other. I'm also write poetry, by the way. So I'm that is my hobby, and I've published some books as well. I write poetry in English as well as Hindi. Yeah. Okay. How many marks we have to score? So generally, it is said that if you score around 70%, you will pass. Yeah. And some of your questions related to CPHQ, videos we can you please play some videos that will help how to prepare for CPHQ so some of the simple questions people ask about. Yes, please, if you can play those videos.
Hi everyone. This video might be of interest to those who want to get certified as CPHQ. NAHQ, in a recently conducted job task analysis for CPHQ, identified areas to update exam content as per the current practices in the healthcare quality profession. The new exam content is effective for the exam on or after March 15, 2023. Now, what is new in the CPHQ exam update? Let us summarize the exam update by NAHQ. Exam content is now aligned to NAHQ's industry standard, Healthcare Quality Competency Framework. The overlap in the topics across multiple domains has been removed, and population health topics have been added to the content. So the updated exam content includes the following topics. Topic 1, Health Data Analytics. Topic 2, Quality Review and Accountability. Topic 3, Patient Safety. Topic 4, Performance and Process Improvement. Topic 5, Quality Leadership and Integration. Topic 6, Population Health and Care Transitions. Topic 7, regulatory and accreditation. Now, there are a lot of questions about the exam update, like, is the exam duration changed? The answer is no. The exam format is the same with 140 questions, 125 of which are scored, while 15 are for pre-testing purposes. Next question often asked is there a new certification? The answer is no. The certification is the same, only the content is updated as per the industry standards. Now, the important question is how to prepare for the new exam update. We say join our CPHQ training program to write your exam successfully. We at Anexas provide all the study material required to prepare for the CPHQ exam. Using Pareto's 80-20 principle, we have segregated 20% of the most important material that we have prepared for the new content as per the updated exam content. This will ease your preparations, and we have trained more than 1,000 CPHQ professionals to succeed in the CPHQ examination in the past, and we provide all the study material for the CPHQ exam preparation, live interactive training for best results, access to all training videos with study material, mock questions for assessment. And if you want to revise the course, you can join our course again at no extra cost. So now that you know all about the new exam update, I wish you the best for the exam. The details for joining our next CPHQ batch are provided below, and stay in touch. Thank you.
So you will be getting most frequently asked questions also when you join our courses. You'll also get to know. We'll give you a question back. Yeah, right.
Do not make these mistakes if you want to become a CPHQ professional or pass the CPHQ exam. The theory in CPHQ is totally different than practical implementation. Make sure you are being trained by those who give practical knowledge rather than just giving simple textbook training. It is not an easy test to pass. Determination and hard work is required, along with the right guidance that is provided, of course, by us at Anexas. Each question is designed to test if the candidate possesses the knowledge necessary to perform the task or has the ability to apply the knowledge to a job situation. So prepare accordingly. Learning the statistical tools is very, very important part while preparing for your CPHQ exam. Many people mostly fail in data analytics and performance improvement topics. And of course, Anexas is expert in that. Many professionals postpone the exam by giving some excuse. If you want to be a certified CPHQ professional, plan it, work hard for it, and give the exam. Excuses will not take you anywhere. Hard work will. Walk the journey with us as Anexas, and you will enjoy the CPHQ preparation.